hope I'm clearly visible and audible. Let me confirm if I'm clearly visible, audible. I will start the class ahead. You have to give me a minute for confirmation. A very good morning, Aarti and everyone. Please give me a thumbs up in the chat box if I'm clearly visible, audible. Someone from the audience. Okay. It will take a second to confirm. Okay, I hope it is working. Yes, I hope it is working. So let me start. So I welcome you all for today's session. A very good morning to all of you. Due to some technical errors, a little bit late today, but we will finish today pharmacokinetics completely. So I welcome you all for today's session. I am Dr. Priyanka here, and today I am here to continue my series of pharmacology. In pharmacology, we have started general pharmacology. In general pharmacology, today we are going to continue the first portion, that is pharmacokinetics entirely. That was a big and most difficult portion to understand. Today we are going to solve many MCQs and many numericals also based on pharmacokinetics. After pharmacokinetics, from tomorrow, I will start pharmacodynamics, right? So without wasting time, let me continue with pharmacokinetics. We have already seen that in pharmacology, we have two branches, pharmacokinetics and dynamics. We have started kinetics, not the dynamics. We know the difference between the two. Pharmacokinetics is what the body does to the drug, and pharmaco D for D. Dynamics means what the drug does to the body. We have seen the definition of both of them. So pharmacodynamics is basically mechanism of action that we will understand tomorrow, the mechanism of receptors and others. And pharmacokinetics is basically what the body does to the drug. There are 4 chapters in pharmacokinetics we have seen. So we have already covered absorption in the last lectures, and I hope the concept is crystal clear to you. The main thing in absorption to understand the pH, the effect of pH on the absorption. So acidic drugs, basic drugs, from where they are absorbed, from there where they are excreted, we have learned the golden rules and we have solved many MCQs based on it. If someone have missed the live lectures, I request them to watch the recordings. It is available on YouTube. After that, we have already seen the distribution. In distribution, the main concept was volume of distribution. Actually, the apparent volume of distribution, VOD. We have seen what is VOD, the formula of VOD, and what is free drug, what is bound drug, and we have seen many contribution of plasma protein binding, how to apply it, right? Okay. After that, we have started biotransformation or metabolism, but we have not finished it. So in the first few minutes, in the first 20 or 30 minutes, I will finish the biotransformation and metabolism. And today, the next 2.5 hour lecture will be on excretion, which is the biggest and most difficult topic to understand. I can guarantee it is very difficult, but I will try my best to simplify this for you. So let me start with biotransformation and continue with biotransformation. So in the first 5 minutes, I will give you a review of biotransformation, what we have read. And in the next 20 minutes, we will finish it, what was left in that. And after that, I will come on the excretion. I have given you an overview what we are going to do, what we have done. So give me a minute. Let me jump on the slide of biotransformation directly. You have to give me a minute. Just a second. Okay, so here I am. I'm almost there. Okay. So biotransformation we have already seen. I will not cover it completely. What I have already taken, you already know. So biotransformation, what do you mean by biotransformation? I have told you. So this is the diagram we always take, right? So this is the drug. Whenever we take any drug by oral route, the drug goes in the esophagus, then it goes in the stomach, then it goes in the intestine. From the stomach, it is absorbed if the drug is acidic. From the intestine, it is absorbed if the drug is basic. I mean, acidic drugs are absorbed from acidic medium, basic drugs are absorbed from basic medium. अभी तक इतना तो concept clear सबका हो गया होगा that for absorption, same pH is required. For excretion, opposite pH is required. That we will see today in the chapter excretion. Okay. So after absorption, the drug is in two forms, the free form and the bound form in the blood. That is the distribution, right? After that, the drug is going to the site of action. It is a free drug which go to the site of action and show its mechanism of action. Now the job of the drug is over. The job of the drug is over. Now drug wanted to get excreted out of the body, but drug is going to the kidney. Kidney is saying, no, I cannot excrete you because you are a non-polar drug. If you want that I should excrete you, I have only one mechanism of excretion via urine, and urine is water. If you want to get excreted in the urine, you have to be polar. You have to be water soluble, you have to be polar. So what the drug will do now? Drug will first go to the liver Ask the liver, can you please convert me from non-polar to polar form so that I can excrete it out of the body? So liver will say, yes, I can do so. And the mechanism is known as metabolism. So that is the definition of metabolism. In metabolism, liver converts the cell. Inside the cell of the liver, there are enzymes which convert a non-polar drug to a polar drug. So you say anything. Either you say a non-polar drug to polar drug. This is the definition. Or you say a hydrophobic drug to hydrophilic drug, or you say a lipophilic drug to lipophobic drug. You can understand it, right? I guess so. This is the definition of biotransformation we have already seen. So I hope none of you have any problem in understanding. So there is chemical alteration in the formula so that a non-polar drug can be converted into polar. We have seen this already. So it basically takes place in liver, but for few drugs there is exception in which other organs are responsible for metabolism, and it is known as extrahepatic sites. So you should learn the exceptions. I'm not reading. In the last lecture I have read all these, and I have explained you all these, but you should know the exceptions. There are only 5 exceptions. You should know the exceptions. And basically for most of the organs, 99% liver is the organ of metabolism, right? Now in liver, non-polar drugs converted into polar drug, but during this conversion, 3 possibilities are there. Either initially drug was active and during this conversion it become non-active, or initially the drug was active and after non-polar to polar conversion it remains active only. Or the third possibility, initially the drug is inactive and after non-polar to polar conversion it becomes active. So the third type is known as prodrug. So prodrug are most important. So we have seen example of all 3. So these are the examples of first type, that is active to inactive conversion. These are the examples of second type, active to active conversion. So these are not important, very important, but the most important are inactive to active conversion, which is known as prodrug. For prodrug, I have already told you a mnemonic. So the mnemonic is in front of you. You know the mnemonic. All prefer doing MD in clinical subjects. So A stands for what, P stands for what. Yesterday we have done very many numericals based on this mnemonic. So we have already seen the mnemonics and questions based on it. So let's skip this portion. Let me come. This portion is also completed. I'm just giving you a review what we have done so that we can start in continuity in a flow, right? So we have done the classification of biotransformation. Now if you want to convert a non-polar drug into polar drug, right? This is a non-polar drug. We can do it by 2 ways. Either we can expose some functional groups on the surface of the non-polar drug. The functional group can be hydroxyl, it can be sulfate, it can be amine, it can be oxygen, right? Because of this functional group, the non-polar drug will get converted into polar drug, and this is known as phase 1. Phase 1 biotransformation or functionalization, because we are exposing the functional group. Give me a thumbs up. And in the second part, we want to convert a non-polar drug to a polar drug. So the second mechanism, how we convert, yesterday I told you, anyone? So we can combine this non-polar drug with a polar endogenous compound, and a conjugate is formed because of the assembly of the two. You can see the assembly, that is the coupling or assembly. So this is known as phase 2 reaction or conjugation. So in both of them, ultimately the non-polar drug got converted into polar drug, but the mechanism is different. In the first, it is converted into polar due to the exposure of functional groups. In the second mechanism, it is getting converted to polar because of combining or coupling or making assembly with the endogenous polar compound. Give me a thumbs up. We have done this, yes or no? So type 1, phase 1 is of 5 type, 1, 2, 3, 4, 5. And phase 2 is of 6 type, 1, 2, 3, 4, 5, 6. So total 11 types of biotransformation reactions are there. We have already seen the names. Can someone help me in enumerating it? Yes. So in phase 1, it was oxidation, it was reduction, it is hydrolysis, it is cyclization and decyclization. Everyone give me a thumbs up. In phase 2, it is triple G SMA. Triple G SMA was the mnemonic. So it is glucuronide conjugation, glycine conjugation, glutathione conjugation, sulfate conjugation, methyl conjugation, and acetyl conjugation. So it depends on the polar endogenous compound which is making assembly. So if the polar endogenous compound is glutathione, or it is a glycine, or it is a whatever it is, so based on that name, it is of that name. So total, all of them are conjugation reactions. Listen, these all are conjugation reactions and these are not conjugation. So total 11 reactions are there. Do you have any doubt in this? We have already covered this portion. Now my advice to all of you, in all these 11 type, what you have to learn. So please make a table like this. Make a table of phase 1 also, phase 2 also. So oxidation, reduction, hydrolysis, cyclization, decyclization. So these are the phase 1. In phase 2 also you make a table. So you can make the table like this. You can make the table like this. What were these? Yeah, triple G SMA. You know the full form. So make columns. So in this, you have to write the name of the enzyme which is responsible for this particular reaction and the examples of the drugs which undergo metabolism by that particular pathway. So please make this table. Only this table is important, right? Only this table. From the first 5, that is from phase 1. These are 5 phase 1 and these 6 are phase 2 and total 11 reaction. Please follow my commands. Please make this table. Please make this table. Yes, Aarti, absolutely right. You can make this table, right? Now, from phase 1, the most important is oxidation and the enzyme responsible here is cytochrome CYP 450, cytochrome 450, right? Apart from it, two another enzymes were there, FMO I have told you and EH, but most important is cytochrome P450. Here also you require the enzyme cytochrome P450 is responsible for both oxidation as well as reduction. For hydrolysis, you require enzyme esterase. Cyclization, decyclization, I don't remember. For glucuronide conjugation, you require an enzyme UDP. So please learn the name of the enzymes. It is given in my notes. Please learn the name of enzymes. And not only this, you have to learn the names of the drugs, examples, at least important examples which undergo biotransformation in human body by that particular pathway. So please complete this table and you can send the snapshot of this table to me on Telegram. So I will check whether it is right or not. I'm not making it because it will take time. I have already explained you in the last lecture. Everyone give me a thumbs up. Everyone give me a thumbs up. Let me see if I can see your chat. Just a second. Okay. You have to give me a minute. I can't see your chat. Okay. Let me open it on YouTube. Yeah, I can see it. I can see it. Yes. So we have seen it is phase 1, phase 2. Phase 1 is functionalization. Phase 2 is conjugation. Another name given here because here a new product is formed in phase 2. A couple is formed. A couple is formed. That is synthetic reaction. And here now nothing new is formed. Only that compound in which functional group are exposed. That's why non-synthetic and synthetic name is also given. Give me a thumbs up. So in both of them, ultimately this non-polar get converted to polar. Here also non-polar get converted to polar. So that is common. So non-polar getting converted to polar in phase 1 also and phase 2 also. So these are the 5 types of phase 1. So, and these are the 6 types of phase 2. These are the 6 types. Total 11 types are there. So I'm skipping this portion. So in each of them, please you read by yourself the name of the enzyme and name of the drugs. I'm skipping it. The most important here is this one and most important in phase 2 is glucuronide. So please give me a minute to skip it. I've covered this in the last lecture. Those who have missed it, please watch the recording. So I'm coming on the mechanism. Now this portion is new from which I have to continue my lecture today. Okay. So mechanism of metabolism. How metabolism takes place. Listen, everyone see here. So this is a drug. Can you see the drug? So you have taken a drug by mouth. It is going to stomach. It is going to intestine. It is absorbed and coming in the blood. So this is the free drug. Now this drug is going to the liver. Can you convert me from non-polar to polar form? Because I want to get excreted and kidney is saying no, I cannot excrete you because you are non-polar. So liver will say yes, please come inside me. Please come inside my cell, my hepatocyte cell. Inside my cell, 2 types of enzymes are present, right? So can you see a hepatocyte here? Please appreciate. This is a hepatocyte. Can you see the purple enzymes? This enzyme is present, this purple, let me mark. This one is present directly in the cytoplasm and this one is present inside the endoplasmic reticulum of this hepatocyte. So the enzyme which is present inside the endoplasmic reticulum of the hepatocyte of the liver. So liver के अंदर है hepatocyte, hepatocyte के अंदर है endoplasmic reticulum, उसके अंदर enzyme है. Such enzyme is known as microsomal. These are the most important enzymes, microsomal. And cytochrome P450 is a microsomal enzyme, right? And the enzyme which is present directly in the cytoplasm is known as non-microsomal enzymes. Non-microsomal enzymes. Now, out of your 11 reactions, what are your 11 reactions? Phase 1 and phase 2. Please enumerate it once. So, phase 1, oxidation, reduction, hydrolysis, cyclization, decyclization. Here it is GGGSMA. You know the full form. The first G is glucuronide. The other G's you already know, right? From this, everyone have an enzyme, a peculiar enzyme. You already know the name of enzyme responsible for that particular reaction. These enzymes, which are microsomal, which are non-microsomal? You tell me that. So from phase 1, these 3 are microsomal and these 2 are non-microsomal. You know the meaning of micronosomal and non-microsomal, I guess now. Microsomal are the enzymes which are present in endoplasmic reticulum. Non-microsomal are the enzymes which are present directly in the cytoplasm of the hepatocyte. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Yes or no? So here you can see in phase 2, it is glucuronide conjugation which is microsomal and rest all are non-microsomal. Rest all are non-microsomal. So the enzyme responsible for glucuronide conjugation, name the enzyme, it is UDP. Name the enzyme, so UDP. So UDP is the enzyme which is present on endoplasmic reticulum and here it is cytochrome P450. Here also cytochrome P450 and here also esterase. So these are the enzymes which are present inside endoplasmic reticulum. Rest all enzymes are present directly in cytoplasm. So you will ask me, ma'am, does it matter whether the enzyme present in endoplasmic reticulum or cytoplasm? Being a doctor, how does it matter for us? So if we are a doctor, we will prescribe some drug to our patient. So how does it matter that after going inside the drug, inside the patient's body, the drug is going to the liver for metabolism. So inside the liver cell, that drug is metabolized either by the enzyme present in endoplasmic reticulum or the enzyme present in the cytoplasm. Being a doctor, how does it matter to us? So it matters. It matters. Why it matters? Because the microsomal enzyme shows drug-drug interaction. So there are two types of drug-drug interaction. Microsomal enzyme induction and microsomal enzyme inhibition. So if you are giving any combination, any two drugs to any patient, you should always be beware that any of these two drugs is metabolized either by microsomal enzyme. If it is non-microsomal, you don't have to fear. You can frankly give any combination. But if it is microsomal, and 90% of the drugs are metabolized by microsomal enzymes, only 10% is metabolized by non-microsomal. So you should be beware, right? Okay. So let me tell you, so it is microsomal enzymes. It is present in endoplasmic reticulum. As I have already taught you, it is present in endoplasmic reticulum inside the hepatocyte. It is present in endoplasmic reticulum. Oxidation, reduction and hydrolysis from phase 1 and phase 2, it is only glucuronide conjugation. Rest all conjugation are non-microsomal. So these are the examples of microsomal enzyme. They can be induced, they can be inhibited. That's why they show drug-drug interaction. I will explain you. So I will take both the situations. I will come on that. And non-microsomal are the enzymes which are present in cytoplasm and mitochondria. So they take all conjugation except glucuronidation and cyclization, decyclization, and some oxidation, reduction, and hydrolytic reactions also, right? But these are non-inducible, so no drug-drug interaction in them. So these are safe. Okay, have you got it? Have you got it? Yes or no? Have you got it? So you can see from phase 2. See, from phase 2, it is only glucuronide conjugation which is microsomal, and rest all conjugation are non-microsomal. Have you seen it? Yes or no? And from phase 1, basically oxidation, reduction, and hydrolysis are microsomal. They are basically microsomal, non-microsomal both, you can say, right? Okay, so let me come on microsomal enzymes which are ultra important, ultra 5-star important for you, right? Listen, so induction and inhibition are the two things. Let me take with inhibition. What do you mean by inhibition? Now you are a doctor, your patient is in your OPD, patient is complaining some two diseases, right? The patient is having some infection, so you want to give some antibiotic also. And patient is having just suppose some acidity, so you want to give some acidity drugs, or patient is having some others, patient is having fever, you want to give paracetamol, patient is having pain, you want to give some NSAID. So you want to give any two drugs depending on the disease comorbidities of the patient, right? It is very common to give the combinations. Now, initially you are giving only drug A. See the drug A. Red is the drug A. Can you see a liver here? Everyone appreciate a liver. This is liver. Inside the liver, can you appreciate a hepatocyte I have drawn for you? Please appreciate this is a cell of hepatocyte inside the liver, right? I have zoomed it out to explain you. And inside the hepatocyte, this is endoplasmic reticulum. Inside the endoplasmic reticulum, can you see a purple? This is the microsomal enzyme. Just for example, it is cytochrome P450, you can say, right? So it is microsomal enzyme, one of the microsomal enzyme. So initially you give only one drug. Please everyone understand, huh? You are giving only one drug to the patient, that is drug A. This is drug A. So you are not giving drug B. So it was very simple. Drug A was going to the liver. Liver, can you please convert me from non-polar to polar? I want to get excreted. So if you can convert me from non-polar to polar, once I become polar, I will be excreted out of the body. I will go to the kidney and kidney will excrete me. So liver will say, yes, please come inside me. My enzyme will do so. So I am having an enzyme inside my endoplasmic reticulum. That is my microsomal enzyme. That will do so. So job was very easy. The things were very simple. But now the things will become complicated once you give the combination. So you are giving a drug B also. Along with drug A, you are giving drug B. And drug B is a inhibitor. Inhibitor. See, it is minus inhibitor. Inhibitor of enzyme. It is microsomal enzyme inhibitor, right? So this drug B, whenever you are giving drug A with drug B, so drug B is going to this enzyme and inhibiting it. By inhibition, I mean the enzyme is non-functional now. The enzyme is non-functional now. It will not do its function. It is inhibited permanently. Permanently or competitively it is inhibited, right? Now drug A will come and ask the liver, can you please convert me from non-polar to polar? I want to get excreted. Liver will say, no, I cannot convert you because my enzyme is non-functional. There is a drug B, which is an inhibitor, which is available in the blood, and it has inhibited my enzyme. So I cannot convert you from non-polar to polar. You will remain non-polar only. So if the drug is non-polar only, it cannot be excreted out of the body. If it cannot become polar, it cannot be excreted. So it will remain in the body for a longer time and it will cause toxicity. It will cause toxicity. Everyone give me a thumbs up. Now listen, these are the two drugs you are giving in combination. So drug A is the parent drug. You can say it is a parent drug or substrate drug. You can say it is a substrate drug. And drug B is the inhibitor drug. Inhibitor drug. So if you are giving such combination, you have to reduce the concentration of parent drug to avoid toxicity. So being a doctor, if you are giving any, I will give you a list of parent drug also. I will give you a list of inhibitor drug also. Try to avoid such combination. So being a doctor, you should avoid such combination. If it is unavoidable, you say, no, my patient is having antifungal infection also, so I want to give antifungal also, and my patient is having epilepsy also, so I am giving anti-epilepsy drug. So I will show you the combination. If you are, it is unavoidable, you are giving it anyway. So you have to reduce the concentration of the parent drug, because if you don't reduce, if you give standard dose of both of them, parent drug will have toxicity. Inhibitor को कुछ नहीं होगा, toxicity parent drug की होगी. Have you got it? Everyone give me a thumbs up. I am trying hard. Everyone. Everyone give me a thumbs up. Yes or no? Can we go ahead? Can we go ahead? First give me a thumbs up, everyone. Do you have any doubt in this? So this is the inhibitor. So the summary of inhibitor is that if you give the parent drug with the inhibitor, so you have to reduce the dose of the parent drug, otherwise it will cause toxicity. That is the inhibitor. I will give you the list of both. Let me take another thing. Okay, so toxicity is the result here. Here the ultimate result is toxicity of the object drug. Object drug means parent drug. So that is the thing we have seen. So I will give you the mnemonic for both. Let's see. So this is the mnemonic of the parent drug. Either you say parent drug, or you say object drug, or you say substrate drug. One and the same thing. So the mnemonic is CT scan. CTSCAN. So there are 2C, right? 2C and 5 drugs from C. So first C, you can see C. C stands for cyclosporin. C stands for calcium channel blocker. C stands for cisapride. C stands for estimizole, and C is okay. C से CAT है यहाँ. Okay. There are 3C: cyclosporin, calcium channel blocker, and cisapride, right? T से tacrolimus. S से statins. You know statins are the drug to lower cholesterol, right? Another C से another mnemonic is CAT. CAT. You should know the full form of CAT. And A से amiodarone. Amiodarone. And N से it is Naviris. Naviris. So please learn the full form. These are the substrate drug, and these are the inhibitor drug. So in my example, these all drugs are red drug, drug A, right? And in my example, these all are green drug, that is drug B, that is inhibitor drug. So whenever you are giving, so if you are giving this combination, learn the mnemonic first. So the mnemonic is vitamin K cannot cause enzyme inhibition. Vitamin ka V stands for valproate. K stands for ketoconazole. It is an antifungal drug. It is a calcium channel blocker. C stands for cimetidine. It is a drug which is given for acidity. You know, ranitidine, cimetidine. C stands for ciproflox. It is an antibiotic. E stands for erythromycin. It is also antibiotic. And inhibition ka I stands for INH. That is, it is an anti-tubercular drug, right? It is an anti-tubercular isoniazid. It is an anti-tubercular. So avoid this combination. If you can't avoid, reduce the dose of the parent drug. So the summary is that if you are giving a substrate drug with a inhibitor drug. So first tell me the names. What are the names? So please learn the mnemonic. So mnemonic is CT scan, and the mnemonic is vitamin K cannot cause enzyme inhibition. Everyone give me a thumbs up. Try to avoid this combination. Try to avoid. Don't give any of this drug with any of this drug. if you are giving toxicity of this drug will happen. This, not of this, toxicity. And if you don't want the toxicity, reduce the dose of substrate drug if you are giving anyhow this combination. That is the summary. Everyone give me a thumbs up. Now learning only mnemonic is not important. The full form of mnemonic is more important, right? So say the full form again, again. CT scan. ये another C is CAT. एक और mnemonic है इसके अंदर. So please say the full form again, and again. Here there are two C, huh? Simantidine and ciproflox. Simantidine and ciproflox, right? Okay. So let's come. So we have seen the inhibition. The summary of inhibition is over. Let me come on induction. Okay. So see here. Again, initially we are giving only one drug, drug A. Again, you can see the liver. You can see this is liver. Inside the liver, appreciate the hepatocyte. There is a cell known as hepatocyte. Inside the hepatocyte, you can appreciate the endoplasmic reticulum. And inside that, the purple is the enzyme, which is a microsomal enzyme. You all can see it is a microsomal enzyme. Now you are giving only drug A. Don't look at drug B. So drug A was going inside. Please convert me from non-polar to polar, and liver was doing this job very happily. And after being converted to polar, it was getting excreted out of the body via kidney. The things were super simple. But the things will become complicated once we add another drug, drug B. Now this time, drug B is an enzyme inducer. It is not inhibitor. It is enzyme inducer. What is drug B? You tell me what is drug B? The drug B is enzyme inducer. Give me a minute. Okay. So drug B is enzyme inducer. Inducer, what do you mean by inducer? It will increase the activity of the enzyme, not inhibit. It will increase. It will the enzyme will become hyperactive. The enzyme will become hyperactive. So when both drugs enter together and B is inducing the enzyme and enzyme become hyperactive, so it will convert all A from non-polar to polar very fast, very fast. So before we want this conversion, of course, we also want this conversion because we want to excrete the drug. But we want this conversion after drug has shown its mechanism of action. Then we want this conversion so that it get excreted out of the body. But when the enzyme become hyperactive, hyperfunctional, before the drug A show its mechanism of action at the site of action, before that only, it got converted from non-polar to polar and excreted out of the body. So efficacy of the drug is decreasing. It is not toxicity. The reverse of toxicity is reduced efficacy. So reduced intensity, reduced duration of action. So if you are giving any drug A, you are assuming it will be active for next 12 hours. But instead of 12 hours, it is active only 4 hours. After 4 hours, the symptoms are appearing again because it is excreted out of the body in 4 hours only instead of 12 hours. So that is the thing. Have you got it? Have you got it? Give me a thumbs up. So it is reducing the efficacy of the substrate drug, right? So that is the summary here. Have you got it? So here, decreased intensity and decreased duration of action, that is reduced effectivity, efficacy of the drug. There the consequence was toxicity. Here consequence is reduced intensity and duration of action. So both things are opposite and both things are happening for the substrate drug, for the parent drug, not for the enzyme inducer or inhibitor. So here you have to increase the concentration of the parent drug because its efficacy is reduced, na? Its duration, its intensity is reduced. It is excreted out of the body. So you have to increase the dose. If you want its action, normally you have to increase the dose here. So again, the substrate drugs are same. The substrate drugs are same. CT scan. You know the full form of CT scan. I'm not repeating again. I will give you a list of enzyme inducer. So the mnemonic is GPRS cell phone. G stands for greaseprubin. It is an antifungal. वहाँ पे भी एक antifungal था. It was ketoconazole. यहाँ पे भी एक antifungal है. It is greaseprubin. P stands for phenytoin. It is an anti-epileptic drug. R for rifampicin. It is an anti-TB. वहाँ पे भी एक anti-TB था isoniazid. यहाँ पे भी एक anti-TB है rifampicin. S stands for smoking. C, वहां पे दो C थे. One was simantidine, which is an anti-acidity drug, and one was ciproflox, which is an antibiotic. यहाँ पे carbamazepine है, which is an anti-epileptic. ये दोनों anti-epileptic drugs हैं. And P for phenobarbital. Phenobarbital, it is a tranquilizer, you can say, sleeping pill. Everyone give me a thumbs up. Everyone give me a thumbs up. Let me summarize. I am trying hard. Now, everyone please concentrate on your gadgets. I am giving you the summary. So let me tell you what are substrate drugs. Substrate drugs also known as parent drug, also known as object drug. Whatever you say, one and the same thing. And what are inhibitors? Inhibitors. And what are inducers? Inducers. First tell me the mnemonic for all three. So the mnemonic here is CT scan. The mnemonic here is vitamin K cannot cause enzyme inhibition. What is the mnemonic here? GPRS cell phone. Everyone give me a thumbs up. try to avoid the combination of the parent drug with this also, with this also. Don't give this combination also and don't give this combination also. Try to avoid. If you can't avoid, what will happen? Substrate or parent drug को कुछ नहीं होगा. Nothing will happen to this drug. Nothing will, oh, I'm sorry, इसी को होगा. Nothing will happen to inhibitor, nothing will happen to inducer. If you are giving this combination, if you are giving the combination with inhibitor, if you are giving the combination with inhibitor, so toxicity of the substrate drug will happen. And if you are giving this combination with the inducer, so reduced efficacy will be the end result. Reduced efficacy, reduced intensity, reduced duration of the drug. So toxicity and reduced efficacy are opposite to each other. So if you at all want to give this combination, then if you are giving the combination with inhibitor, decrease the dose of the substrate drug to avoid toxicity. And if you are giving this combination with the inducer, increase the dose of the parent drug to avoid decrease efficacy of the drug. So I cannot super simplify than this. This is my best efforts I have put here to super simplify the things for you. I want your appreciation. Everyone please appreciate. Yes or no? You got it? Yes or no? Write down. You got it? You got the concept? You got the mnemonics? The full form of the mnemonics are important. I am saying it again. The full form is important. Only mnemonic, learning mnemonic is nothing. The full form, the one who knows the full form, that only can answer it correctly. Now I will launch many polls based on those mnemonic. Now see, everyone see what I am saying. यहाँ पे भी दो C हैं और यहाँ पे एक ही C है. Say the full form. What is that C? So the 2C in inhibitor, I am saying it is ciproflox, it is ciprofloxacin, and it is simantidine. Simantidine. Please learn. One is acidity, simantidine. One is acidity, one is antibiotic. And the C here is carbamazepine. Carbamazepine. So you will get confused in the full form. So C is common in all of them. Right. So say the full form again, again, again. It will be helpful for you. Everyone give me a thumbs up. So do you have any doubt in this? Should I proceed ahead? Should I proceed ahead? Yes or no? So we will say the full form once. We will say the full form once again. So vitamin K cannot cause enzyme inhibition and GPRS cell phone. So learn the full form of inducer and inhibitor. These are inhibitors, I guess, and these are inducer. So don't mix. हाँ, inducer का mnemonic है GPRS cell phone और inhibitor का mnemonic है vitamin K cannot cause enzyme inhibition. Right? Say the full form. V for valproate, K for ketoconazole, 2C. Who will tell me what are 2Cs here? One is simantidine, one is ciprofloxacin. So simantidine and ciprofloxacin. E is erythromycin and I is INH, that is isoniazid. Come on inducer, it is grisofulvin. So यहाँ पे grisofulvin है. P is phenytoin. 2P are there. 2P. One is phenytoin, one is phenobarbital. Phenytoin is anti-epileptic drug. Phenobarbital is the sleeping pill, right? R is rifampicin. S is smoking. What is C here? C here is carbamazepine. Carbamazepine, it is an anti-epileptic drug. Now learn the C. C is common in all of them. Now both have one antifungal. Here the antifungal is grisofulvin. Here antifungal is ketoconazole. Both have anti-epileptic. Here anti-epileptic is phenytoin and carbamazepine. Here anti-epileptic is valproate. You can say. Give me a thumbs up, everyone. Give me a thumbs up. Both have anti-TB. Here anti-TB is rifampicin. Here anti-TB is isoniazid. So I am trying hard to give you. So you can get a clinical questions based on all these. So you should know the full forms. Let me move ahead. So we have done and microsomal enzyme. Now let's see non-microsomal enzyme. Microsomal enzymes where we have seen two things, induction, inhibition. You know the summary of both. If you are giving it with inhibitor, reduce the dose of the substrate. If you are giving with inducer, increase the dose of the substrate. And you know what are inducer drugs, what are inhibitor drugs. Substrate is common on both of them. The mnemonic is CT scan. Done? Can I proceed ahead? Do you have any doubt? So, Pranali, Grace, Aarti, Abhirami, Nitesh, Kuldeep, anyone else? Should I proceed? Okay. Let me move on non-microsomal enzymes. If you are people with me, let me move on non-microsomal enzymes. Non-microsomal I'm not teaching because non-microsomal enzymes are present in the cytoplasm and these are not induced, not inhibited. If inducer inhibited drugs are there, they are neither inducible nor inhibitable. So drug-drug interaction is not there. So these are the safe enzymes, you can say. You can learn about them. Now apart from these two, there is a third mechanism that is known as Hoffman. Very commonly asked MCQ. Hoffman. It is the third. Third mechanism of metabolism. You will say, ma'am, what does it mean? What does it mean? Okay, listen. What do you mean by metabolism? Everyone tell me. Metabolism का मतलब क्या होता है? What do you mean by metabolism? Metabolism, the free drug which is present. So you are taking a drug by mouth. It is going in the blood, via stomach or intestine. Depending acidic or basic, it is reaching the blood. After reaching the blood, it is going to its site of action and showing mechanism of action. Now the drug want to get excreted, but it cannot be excreted out of the body because it is non-polar. So before that, it has to move to the liver for doing the metabolism. In metabolism, liver converts non-polar drug to polar drug via phase 1 or phase 2. You know the meaning of phase 1, phase 2, either functionalization or conjugation. Liver is doing so. How liver is doing so? Actually inside the liver, okay, actually inside the liver there are hepatocytes, or actually inside the hepatocytes two type of enzymes are there. One present in the cytoplasm are non-microsomal, and one present in the endoplasmic reticulum are microsomal, right? So microsomal are dangerous because drug-drug interactions are there. They are inhibited also, induced also. But non-microsomal are safe. They are not dangerous because no drug-drug interaction is there. These are neither inhibited nor induced. Give me a thumbs up. Give me a thumbs up. That was the summary. Now, drug want to follow a third path. The third path. Drug is not going in the liver. Drug saying, no, I will not go to the liver. I will directly excrete it. But drug is non-polar. So how drug directly go to the kidney and get excreted without going to the liver? Is it a way? Yes, there is a way. So drug will do some alteration in the structure itself so that it get converted from non-polar to polar in the blood only. No enzyme is required. No enzyme is required. Mind my words. Neither microsomal enzyme nor microsomal enzyme. None of the enzyme is required. Drug itself is doing some alteration in the chemical formula कि यहाँ से निकाल के इधर लगा दिया, इधर से निकाल के इधर. So one group here, one group there. Some alteration in the 3D molecular formula so that it got converted from non-polar to polar. Drug is doing it by itself without the agency of enzyme. Without the agency of enzyme. So it is very rare. It happens in the blood only. No liver is required. And it is known as Hoffman elimination. And once it got converted to polar, it will go directly to the kidney without going to the liver. So no need of liver. Give me a thumbs up. So spontaneous molecular rearrangement of the drug without agency of enzyme. Neither microsomal enzyme is required nor microsomal enzyme is required. None of the enzyme. Actually, liver is not required. Blood mein hi molecular rearrangement, drug will do it by itself. Only one drug in the world do so. That is atracurium. Atracurium. It is a local anesthesia. So please learn the example. Since it is having only one example, so it is very important, right? Learn the definition, learn the example. So there are three ways of metabolism. What are the three ways? So metabolism is over. What are the three ways of metabolism? Who will tell me? One is phase 1, phase 2. Phase 1, phase 2 both have two types of enzyme, microsomal, non-microsomal. So microsomal enzymes, non-microsomal enzymes, and third is Hoffman. Everyone give me a thumbs up. So metabolism is over from my side. We will do some MCQs which are already asked in your previous year questions of multiple exams, NEET PG, FMG, INICT. So we will do those questions, and after that we will move on the last chapter, excretion. Are you people with me? Everyone first give me a thumbs up if you people ready for the polls. So yes, Aarti, phase 1, phase 2 and Hoffman, you can say the three types. So everyone please participate in the poll. Please, at max you will be wrong. उससे ज़्यादा क्या होगा? So if you see any question, please try to answer it. Please try to answer it. Just a second. Yeah. Okay. So is the question visible to you? So question is little bit blurred. Plus, okay, I will read it for you. So cytochrome P450 is inhibited by. I'm asking the inhibitor. So tell me the mnemonic of inhibitor applied here. What is the mnemonic for inhibitor? Vitamin K cannot cause enzyme inhibition. Apply the mnemonic. Apply the mnemonic. Is what is the answer here? Apply the mnemonic. Who will tell me what is the answer here? So, is phenobarbital coming in this mnemonic? No, there is no P. Is phenytoin coming in this mnemonic? No, there is no. What is the another mnemonic of inducer? Inducer का भी बताओ. Inducer का mnemonic क्या है? Because these all options are coming in inducer. So, what is the mnemonic? GPRS cell phone. So, phenobarbital and phenytoin both are coming in this mnemonic. Not, it is an inducer. It is not inhibitor, right? CCl4 is coming nowhere, neither here nor there. But what about simantidine? One of the C here is simantidine. So one C is simantidine, another C is ciproflox. I have told you very clearly. So everyone is right. Very good. Pranali, Shoche, Abhirami, Peter, Grace, Aarti, Kuldeep, you all, Rishinika, Ashish, you all are right. Very good. The correct answer here is B. So that is how you can apply. Now you can see the examiner have tried a trap for you. He has given the options from other mnemonics so that you got confused. But you didn't have, you don't have to confuse, right? Your concept should be crystal clear. So apply the mnemonic. Here it is cimetidine. C is cimetidine. So it is a mnemonic for inhibitor. Now this is the next question in front of you. Again apply the mnemonic. What the examiner is asking, read the question. Which of the following is inhibitor? Cytochrome P450 means microsomal enzyme. So which of the following is microsomal enzyme inhibitor? Any enzyme, microsomal enzyme. So they are asking for cytochrome P450, which is one of the microsomal enzyme. They are asking again inhibitor. So what is the mnemonic for inhibitor? Apply both mnemonic, huh? And what is the enzyme for mnemonic for inducer? Who will tell me the two mnemonics? Inhibitor का mnemonic है vitamin K cannot cause enzyme inhibition. और inducer का mnemonic है GPRS cell phone. Apply it. See the options. So, okay, I will say ketoconazole. Yes. So ketoconazole is coming here. So I guess the answer should be A only, ketoconazole. Okay, let me see the other three options. What about rifampicin? It is coming here. What about phenytoin? It is also coming here. But what about INH? INH भी तो यहाँ पे आ रहा है. So two options are correct. Ketoconazole and INH both are coming here. Both are coming. So according to me, A and D both are the answer. Why you all are saying only A? Why you are not saying D? Anyone? D भी तो आ रहा है. INH is what is I here? It is isoniazid, no? Isoniazid is INH, anti-TB drug. So both are coming. Why you are not saying D? Give me a thumbs up if you appreciated it. So both answers are correct, A and D. So maybe the question is from PGA. Maybe give me a thumbs up if you realize your mistake. Now what you students do the mistake, you read option in sequence. You read option A, then option B, then C, then D. If you found the correct answer A, you don't take trouble to read other three options. Now this is not a good habit. This is not, sometimes you may be wrong, right? So sometimes option B, C, D is more appropriate for that particular question as compared to answer A, right? So in your exam, you get, before starting the exam, you get some declaration. So in the declaration, it is written that out of the 4 options, mark the best option. It is not always the most correct. In any question, you can get multiple correct answers, but you have to go for the most correct or most best answer. So read all 4 options. That is my point. That is my point. So don't just rush. You ketoconazole A में ही मिल गया तो तुम इतना super excited हो गए कि BCD कुछ भी है जाने दो. Answer is A. No, don't do that. Rule out other 3 also. So make a habit of ruling other 3 options before marking your answer. So this will save you some time in exam. So correct answer is A and D. Here also I have written A, but yeah, A and D both are the correct answer. Okay. So you can see INH is also there and ketoconazole is also there. So both, why not both? Why not both, right? So coming to the next question. So next question is in front of you. So Hoffman's elimination is, what is the definition of Hoffman's elimination? Read the 4 options are in front of you. Read the 4 options. Is it inactivation of the drug by metabolizing enzyme? Is it unchanged excretion by the kidney? Is it excretion in feces? Or is it inactivation by molecular rearrangement? What is it? So you all are right. So drug itself is doing some molecular rearrangement without the agency of enzyme. So no enzyme is required. And after molecular rearrangement, it will be excreted in the kidney. It is not unchanged excretion. It is changed. But change is done by itself. It is not in feces. It will be in urine only. So other 3 options are incorrect. I am ruling out. And the correct answer here is D. And you all are right. Very good. Very good. So next question is in front of you. Which of the following does not induce enzyme, microsomal enzyme? So which of the following is not an inducer? Apply the mnemonic. Apply the mnemonic for inducer, which is not coming in that mnemonic. Tell me. And apply the mnemonic for inhibitor also. Okay, examiner will confuse you between the 2 mnemonics. So apply both. Apply both. Inducer का क्या mnemonic होता है? GPRS cell phone. Tell me from this what is not coming in this mnemonic. And inhibitor का mnemonic होता है vitamin K cannot cause enzyme inhibition. So tell me, okay, I will go one by one. So first answer is cimetidine. What are the C's? Say the full form. C क्या है? यहाँ पे C क्या है? What is C here? This C is carbamazepine. Carbamazepine, right? And these 2 C, ciproflox and cimetidine. I guess I am right. Yes or no? Cimetidine. You have to help me. Sometimes I also get confused. Yeah, I'm right. I guess I'm right. Now apply it. So there, what is the examiner is asking? Which of the following is not an inducer? So see this mnemonic. Which of the following option is not coming in this mnemonic? So of course the answer is cimetidine. Cimetidine is coming there, not here. So the correct answer is A only. It is not coming here. Let's see other 3 options before marking. So be super duper sure before marking the answer. Grisopulving, yes, it is coming. Rifampicin, yes, it is coming. Phenobarbital, Yes, it is coming. So rest three options are coming. But what about cimetidine? No, it is not coming. It is coming there. Now, those who don't know the full form very correctly, they will think that this C is cimetidine only and they will get confused. So please keep your concept super clear. Everyone give me a thumbs up. Yes, you all are right. The correct answer here is A and everyone is right. Very good. Very good. So let me move ahead. So, okay, there are many questions based on this. So today only this is your homework to solve all the questions on enzyme inducer and inhibitor. You will find more than 70 questions, 70 MCQs based on these two mnemonics only. So these two mnemonics are ultra important for you people. What are the two mnemonics? Enzyme inhibitor and enzyme inducer. I always say my students that if you are a second prof student, MBBS, and if you don't know these mnemonics or full form of these mnemonics, now you can't pass your second prof. Definitely you can't pass. Please take my words. This is that important topic. That way it is a very important topic. Inhibitor का mnemonic है vitamin K cannot cause enzyme inhibition. और inducer का mnemonic है GPRS cell phone. Say the full form. It is more important. So write down. It is valproate, ketoconazole. The two C are important. It is cimetidine and ciprofloxacin. It is erythromycin and isoniazid. Right. Write down the full form here. It is greasephulvin. Greasephulvin के साथ grapefruit juice भी add कर लो. Grapefruit juice. Right. Add it. There are two P. One is phenytoin and one is phenobarbital. R is rifampicin. And S is smoking. Smoking is also considered a drug. And here C is the, what was C here? Carbamazepine. So say the full form again. These two mnemonics are super important, 5-star important. Make a note. So coming to the next topic now. Before coming to the last chapter, excretion, one more topic to be taught here is first pass metabolism. You know what is first pass metabolism? What is first pass metabolism? Everyone see here, I'm explaining you. So listen, you are taking a drug by mouth. This is the oral route. So the drug is going in the mouth, it is going in the esophagus, it is going in the stomach, and it is going in the intestine. If the drug is acidic, it will be absorbed from the stomach. If the drug is basic, it will be absorbed from intestine. Ultimately, drug reaches in blood. After reaching in the blood, some proportion got converted into bound form by binding with the plasma protein. If the drug is acidic, it will bound with albumin. If the drug is basic, it will bound with alpha-1 glycoprotein. So ultimately, some form is free, some form is bound. Now, after that, what will happen? So, what is this blood vessel? Name this blood vessel. Can anyone name this blood vessel? Name of this blood vessel. What is this blood vessel? So, it is going in blood vessel, no? So, what is this blood vessel? Tell me the blood vessel of the GIT. What is the blood vessel? So, this is GIT, no? This is stomach and this is intestine. So, either the drug is absorbed from stomach or it is absorbed from intestine. So, the blood vessel here is portal vein. This vein is portal. Yes, very good. This is portal vein. This is portal vein. So this portal vein, first it will go taking the drug, it will take the drug to the liver. First portal, it cannot go directly to the site of action. Listen, for the simplicity, I have drawn this diagram, but actually first, if it is a portal vein, it will go to the liver. It will take the drug to the liver. So here is the drug going to the liver. The free drug is going to the liver via portal vein. Now you understand the mechanism of metabolism. Liver is an organ of metabolism. So in liver, enzymes are present. Let me draw the purple enzymes. So these can be microsomal, non-microsomal, whatever enzyme, they will act on the drug and they will convert the drug from non-polar to polar. And if the drug is converted from non-polar to polar form, the drug is directly excreted out of the body. Whatever non-polar is remaining, that will continue ahead. So non-polar will continue ahead and that will go. यहाँ से निकलेगा क्या? यहाँ पे गया तो portal vein. This is portal vein entering the liver. From exiting the liver is hepatic vein. So the one vein which enters the liver is portal vein. The one which exits it is the hepatic vein. Now hepatic vein contains only that portion of the drug which was non-polar. Polar is already excreted. Give me a thumbs up. Now hepatic vein will go to the heart. Let me draw a heart. All veins go to the heart now. The right side of the heart, SVC, IVC. So hepatic vein will go to IVC. IVC will go to right side of the heart. Right side say impure blood will come to the lungs and from lungs pure blood is going to the left side of the heart. The pure blood is going to the aorta. So ultimately the drug is reaching the aorta. From aorta it will go to its site of action. So this actually happens in the body. It is not directly. For the sake of understanding, I always take कि यहाँ से ये यहाँ जा रहा है. No, यहाँ से ये यहाँ directly नहीं जा रहा site of action पे. ये पूरा ऐसा चक्कर करके जा रहा है. Listen, if you are taking 100 milligram of the drug, if all 100 is absorbed, just suppose it is reaching in the blood, right? So it is reaching in the portal vein. So 100 is going in the portal vein. entering the liver. But out of the 100, drug is converting 70 of the drugs, 70 milligram is converted from non-polar to polar. So 70 gram is excreted without acting. So it is wastage of money. You are paying for 100 milligram. You are taking a tablet of 100 milligram. 70 milligram is excreted in the urine without showing action. Without showing action, give me a thumbs up. And only 30 is going ahead in the portal vein, in the hepatic vein, out of the portal vein in the hepatic. Whatever 30, it will go in hepatic vein, then it will go in IVC, then it will go in right side of heart, then it will go in lungs, that it will come in left side of heart, then it will come in aorta. After coming in aorta, that 30 will go to the site of action. So हमारे लिए तो वो 30 काम का हुआ ना. Give me a thumbs up. Give me a thumbs up. So this is known as first pass. First pass metabolism, because drug is first passing from the liver before going to the site of action. I want drug to go directly to the site of action, show its action, then go to the liver. But drug is first going to the liver, getting metabolized, and then going to the site of action, whatever remaining. So most of the drugs are getting converted. Now different drugs have different first pass metabolism. Some drugs have very high first pass metabolism. You are giving 100 milligram, out of 190 will be excreted. Due to first pass metabolism, only 10 will reach in the site of action. So there is no use of 10. You are giving 100, only 10 is reaching. So what is the use of giving it? Give me a thumbs up. So such drugs which have high first pass metabolism, don't give it by oral route. If you give it by oral route, it will liver में वो निपट जाएगी. Only 10% of it will reach that if I'm having a headache, if I'm taking a drug for it, and if the drug is having high first pass metabolism, and if I'm taking by mouth, so of course it will go in my stomach and intestine, it will absorb in portal vein, and portal vein will carry the drug to the liver. And because my drug is having high first pass metabolism, out of 100, liver will take maximum drug to the excretion, and only very few amount will come in the aorta, that will go to my brain and act on my headache. So there is no use of giving. So my headache will not be cured because I am giving 100, only 10 or 5 is reaching, only 1 is reaching. So I will not, my disease will not be cured. So there is no use of giving such drug by oral route. So the summary is that the drug having high first pass metabolism, don't give it by oral route, give it directly IV or any other route. Any other route. If you give it by any other route, it will not go in portal vein. It will directly go in aorta. Everyone give me a thumbs up. Everyone give me a thumbs up if you got it. So you should know the drugs which is having high first pass metabolism. So what is the definition? Metabolism of the drug during passage from the site of absorption to systemic circulation. By systemic circulation, I mean aorta. So from the site of absorption, that is from stomach or intestine, before reaching aorta, it got metabolized. So I want that is from stomach or intestine, it directly reached the aorta, so that from aorta, it goes to the site of action. But from stomach or intestine, it got metabolism, raste mein hi metabolism ho gaya, before reaching to the systemic. So all oral administered drugs are exposed to metabolizing enzyme. Give me a thumbs up. Give me a thumbs up. So that is the thing. That is the thing. So you can see the diagram. If you are giving any drug by oral route, see this is the drug you are giving by oral route. So it will go in stomach and intestine. So can you see this is stomach and intestine. So first it will go in portal vein. So portal vein is carrying the drug to the liver. After going in the liver, it is coming out of the hepatic vein. Hepatic vein is going in aorta. Not directly, it is through heart. So from the right side of the heart to the lung to the left side of the heart. Ultimately, it will reach to the aorta. Aorta में से वो जाएगा site of action पे. So this is the first pass metabolism. So you are giving the drug via GIT. So GIT से before reaching to the aorta, I want directly aorta, so that from aorta it is going to the site of action, right? But this doesn't happen. रास्ते में आएगा liver. So liver is the first pass. Liver is the first pass. So drug has to pass first from the liver before going to the systemic circulation. Drug has to pass via liver before going to the systemic circulation. Give me a thumbs up. That is known as first pass metabolism. Now give me a list of the drugs which have high first pass metabolism. Being a doctor, I should know it. I should know the list so that I will never give these drugs by oral route to my patient. I will give by other route. I will never offer these drugs in the form of the oral tablets. I will offer some other route, either IV, IM, sublingual, any other route. But oral route is not effective for these drugs because of high first pass metabolism. So I will never offer tablets of these to my patients. So being a doctor, it is important for me to know the drugs. So I'm having a mnemonic for it. Nitrates have large PSM. You can learn like that. Nitrates have large PSM or pre-systemic metabolism or PSM. So nitrates ka N stands for nitrates only. Have ka H stands for hydrocortisone. Nitrates is a drug for angina. You may know it, right? Have is hydrocortisone. It is a steroid. Large का L is lignocaine. It is a local anesthesia. It comes in the form of the jelly. It is not tablet. Lignocaine की कभी tablet नहीं आती है. It is in the form of the jelly. You know, you apply jelly in the form of the ointments, right? Local anesthesia का काम होता है, right? PSM, propranolol, it is a beta blocker. Salbutamol, it is also a beta blocker. And M क्या है? Morphine. It is a opioid. So say the full form again. Nitrates have large PSM. Say the full form. Nitrates, hydrocortisone, lignocaine. What was P? Propranolol, salbutamol, morphine. Everyone give me a thumbs up. So please learn the mnemonic. Please learn. So, okay. So those drugs, uh, bioavailability is more for oral as compared to parenteral. Parenteral don't have a high first pass metabolism. Oral route have first pass metabolism. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Sometimes because of high first pass metabolism of some drugs, there is drug failure. Drug failure का मतलब समझा? Drug is not showing the action. I am giving 100 milligram of the drug to act on the disease. But instead of 100, it is only 10 milligram or 1 milligram reaching on my site of action and showing acting on the disease. So my disease will not be controlled. So that is known as drug failure. So it is one of the important cause of drug failure. Give me a thumbs up. Now sometimes drug failure, you can say for avoiding conception, females take OCP, you know, oral contraceptive pills. To avoid conception. They don't want conception. They don't want pregnancy. The couple don't want fertility. They don't want pregnancy right now at this phase of time. So female take OCP. Just suppose OCP have high first pass of metabolism. So the female will become pregnant. The couple will conceive instead of taking OCP. So that is a drug failure. So it can be one of the example. Give me a thumbs up. Everyone give me a thumbs up if you got my point. So there are many examples. That was one of them. But drug failure is the consequence. So we will do some polls based on this mnemonic. Please read the question. It is a question from previous year questions of NEET PG. So drug having highest first pass metabolism. The four options are in front of you. Is it theophylline, aspirin, tolbutamide or lignocaine? Apply the mnemonic. Nitrates have large PSM. So what is large? Large is lignocaine. Yes, you all are right. So correct answer here will be D. So what about the other option? Theophylline? No, it is not coming in this mnemonic. Aspirin? No, it is not coming in this mnemonic. Tolbutamide? No, it is not coming in this mnemonic. So rest three options are ruled out. Don't forget to rule out other options. So correct answer here is lidocaine. Yes, you all are right. Very good. Very good. Correct answer is this. So many questions are on this. I'm not launching all, but you will get many in your books or on your app, right? So many questions are on first pass metabolism. So drugs having high first pass metabolism. Everyone give me a thumbs up. So I finished 3 chapters till now. I have finished absorption. I have finished distribution. I have finished metabolism. Now coming on the last chapter, that is excretion of the drug. Excretion of the drug out of the body. Excretion of the drug, the last chapter. Now believe me, these 3 chapters were very easy in front of this chapter. So this chapter is the most difficult chapter as per my knowledge. So it is very difficult chapter to understand the concept. It is very conceptual, nothing to mug up, everything to understand, but very difficult to understand. But I will try my best to give you the concept and super simplify the concepts for you. There are many numericals also in this chapter, many formulas and many new. Do you have numericals in your syllabus? So what you all aspirants are, I don't know. Whether you are targeting your university exam or whether you are targeting NEET PG, FMG, NICT. So numericals are common in NEET PG. But FMG maybe they are not very common. But yeah, they can come. The simple numericals can come. Right? So numericals भी बहुत ज़्यादा होंगे इसमें. Now here I will tell you what is excretion, what is the rate of elimination, what is clearance, what is order of reaction, what is T half. So many numericals on that, many numericals. So you have to understand the concept. It is a big chapter, big chapter. So give me a break just for 5 or 10 minutes. And after that in another link, I will continue it. So I want everyone to be back. Let me announce my next lecture. You can go then. So just after a break of 10 minutes, I will continue it. So which link you have to join? Let me tell you. Give me a thumbs up. Just a second. Okay, so here I am. So thank you very much for being with me for this lecture, but I'm continuing it in the next class. So next class is after a break of 10 minutes. That is at 11:45 a.m. sharp. 11:45. After 10 minutes at 11:45 a.m. sharp, I will continue. So join episode number 8 of Pharmacokinetics. That is the next link. You have to join that link. Episode number 8 of Pharmacokinetics on Let's Crack NEET PG channel of YouTube channel. Let's crack NEET PG. So you have to join that just after 10 minutes. Thank you very much. Very much. Don't forget to write your feedbacks in the comment box, and don't forget to click on the like button if you like this. And don't forget to follow my profile link on Unacademy app. You will get notification of all my free classes if you follow my profile link, right? Now for the newcomers on Unacademy, we have two types of subscriptions, Plus and Iconic. If you take Plus subscription, you will get only Unacademy access. And if you take Iconic along with Unacademy, we will provide you prep letter also. So if you are thinking of purchasing any subscription, go with Iconic. The price difference is less, but here you are getting additional advantage of prep letter, right? These are the various plans available with us. So whatever plan is best for you, you can go with that plan. And all you will be eligible for all the batches. There are separate batches for university, NEET PG, FMG, and INICT. You can have a look on various plans in the Plus. You can have a look on various plans in the Iconic. The minimum, the shortest plan you can say is 3 months. So you can give a trial taking 3-month plan, and the longest plan is 4 year. You can notice the price of all of them. Longer the plan, cheaper it is per month wise. So if you're a first prof, second prof student, you can go with a longer plan. It is my advice. To follow or not, it's your wish. But once you take the plan, you will be, your all 19 subject preparation will be on the correct path, right? And before purchasing any of this plan, please apply my code before payment. The code is Sachdev10, SACHDEV. SACHDEV. Sachdev is my surname. Sachdev10 is the code. If you apply this code before payment, you will get maximum discount on all of these plans. Thank you very much for being with me. And please join me back just after 10 minutes. Everyone, we will start with excretion. Join episode number 8 of